Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine in Pennsylvania for our members and their patients. Thanks for tuning in.
Hello and welcome to the latest episode of the POMA Does podcast, sponsored by the Pennsylvania Osteopathic Medical Association. I'm Dr. Kaylin Strasser-Curtis, a current family medicine PGY3 resident at the Penn Highlands Healthcare System in DuBois, PA. Today, we're going to explore the topic of physician contracts. I'm privileged to be joined by my co-resident, Dr. Timothy Kennedy, a current PGY2 family medicine resident, and Megan Hansley, Director of Physician Contracts and Onboarding at Penn Highlands Healthcare. Welcome to you both, and thank you so much for joining me in today's discussion. Megan, why don't we start with you and how you became involved with physician contracts and onboarding?
Hi, Caitlin. How are you doing?
Good. How are you?
Doing good. Well, I've been here at Penn Highlands for the past 17 years, and I'm currently within our physician network, and I do all of our contracts for all of the new physicians coming aboard Penn Highlands, and then also all of our renewal contracts for all of our physicians and our APPs across the system.
Perfect. Dr. Kennedy, you want to give a little bit of your background, kind of what your plans are for the future?
Sure. So I plan on doing outpatient primary care. I'm a primary care resident along with Dr. Strasser-Curtis. And I think what I'd love to do is just outpatient primary care in kind of like a rural area setting, a lot like what DuBois has to offer.
Awesome. I guess I didn't mention previously, but I am planning on pursuing sports medicine. So it'll be nice to talk to you, Megan, about kind of family med and a specialty contract. As we all know, employee contracts are way more than just the money, but we also know it's very easy for new physicians to focus on that salary number and forget about the rest. So let's start with the basics. What are the big components of a physician contract besides the compensation and salary?
Okay, so on your typical type of contract, you have the responsibilities of the physician, you have the responsibilities of your employer, assuming it's an employment contract, and then you're going to run down through the other different components of the agreement. You'll have the term of the agreement, you'll have a notice period in there. You'll have medical malpractice, you'll have your compensation, your benefits. Some of those agreements are also going to involve a restrictive covenant. So there's a lot of other components that go into that agreement, not just the compensation.
Perfect. Let's just go over terms of employment first, if you don't mind. So kind of off of that, like the statement of the employment, your job description, kind of what your call schedule is going to look like, the regular office schedule, your duties, your locations, anything else we can think of. It's different because Dr. Kennedy's going into family medicine versus specialty. So how do you kind of approach those contracts, Megan, the differences between primary care versus a specialty?
Each organization is different. What they do is you're going to look for an employment agreement that's very specific to your specialty. So Tim, with you going into outpatient, you're going to look for different components in that agreement, a little bit different than Caitlin, or perhaps a little bit different than any hospice or inpatient type physician. You know, your components of what you're focused on in that agreement are going to look a little different than someone else's.
And I guess a follow-up question to that is, for somebody that might not want one of the cookie cutter contracts that for you guys to employ, you probably end up printing out initially, how individualistic do you make those contracts in terms of call schedule, all that kind of stuff?
Absolutely. So each contract is different. What you're going to look at, you know, whether you're a physician coming straight out of residency, or if you're a physician that's transitioning, you know, you've been out for a little while transitioning to another practice, you're going to take a look at the agreement that's presented to you from your employer, whatever hospital that you may be looking to work for, or whatever private group you may be looking to work for. And what you're going to want to do is to go down through that agreement and make sure that it's specific for what your needs are. And, you know, make sure it has all of the components that need to be spelled out so that you don't have any surprises down the road. You want to make sure, you know, maybe compensation is the most important thing to you. So you're going to hone in on that. Maybe quality of life is more important to you. So hone in on that. So you're going to take a look at all of the different components in that agreement and just make sure that it's tailored to what your needs are. And the hospital is also going to take a look to make sure that it's tailored to what their needs are, because you want both parties to be involved in the final contract. And what I mean by that is you don't want any surprises down the road. You want to make sure that your needs are in that agreement, their needs are in that agreement, and that everything is spelled out. Maybe you have an anticipation, or the hospital or the group that's employing you has an anticipation of what that language in that contract is to read.
I mean, it's really understandable that both parties have to compromise on some sort of contract, right? There has to be some pulling and tugging on both sides. And I'm glad she talked about compensation a little bit, because the stuff that I know just from being just a PGY2 resident and having never signed a contract before, but some of the stuff in terms of compensation, I know there's salary-based contracts, there's RVU-based contracts, that kind of stuff. And I wanted to see if you could shed some light on the differences between those contracts, pros and cons, stuff like that.
Absolutely. So it all depends as to what type of group that you're looking to go into. If you're going into a private practice or an employment model, there's a lot of different compensation options for you to take a look at. You can take a look, the hospital may offer you a guaranteed base compensation model. They may offer you a work RVU compensation model. If it's a private group, it may be based on billing or collections. Let's say it's like a PRN agreement or something of that nature. To maybe down the road, you working outpatient, you have a spare weekend or two and you want to pick up some hospitalist shifts on an inpatient basis, you would look at a daily shift rate of something of that nature. So every different compensation structure is a little bit different.
Well, I guess for the people who are also listening, could you kind of give a description on an RVU based model, what it might look like to somebody who's interested in going that route?
Absolutely. So on a work RVU model, you would receive work RVU credit for the work that you did. And each different office visit or procedure, all of them are worth different work RVU codes. Whenever those work RVUs come through, depending upon what specialty it is, you determine what the dollar per amount per work RVU is, and then that's how that compensation structure would be calculated.
And all of that's different just based on, because you talked about different procedures and things. If you bill visits differently, other procedures are worth certain many RVUs and stuff, and it's almost like a game. At the end of the year, you're trying to get the most points.
Yes, as long as you're still compliant, yes.
Megan, how with RVU do quality metrics kind of work into that, or is it just based on how you bill? Because I know some hospitals are really trying to hit those quality measures. So is that also considered in compensation?
Yes, on subspecialties, I mean, every hospital is going to be a little bit different, but on some specialties, we do offer a quality component. I foresee as there's more and more focus on quality, I do think that health systems will start migrating some compensation in that direction. But yes, so we do have quality metrics and we do have incentive plans based on those quality metrics.
Awesome. That seems like a good way to make some money. So other parts of the contract that are really important, I think, is your health benefits. I know I have a daughter, so making sure that she's well taken care of with health, vision, dental. What should a new physician or someone that's renegotiating their contract kind of look at when they think of those things?
Actually, Caitlin, I'm really glad you brought that up. It's a really good component is to take a look at what the private group or the hospital are offering. So you want to take a look at the entire benefits package. You'll see some benefits. Maybe you come out of residency and you interview at 3 different locations. They're going to offer you a dollar amount or a compensation package for the position that you're interviewing for. Another key component to that is to review that benefits package, because some of those benefits are going to be much higher than others. And you really want to be able to go down through there with a fine-tooth comb. First, you're going to want to start to see what is it that you need. Maybe you need individual coverage, maybe you need family coverage. And then you also want to take a look at the other benefits that organization is offering. One really important thing to take a look for is malpractice insurance. You want to make sure that you understand the malpractice insurance, whether it's per occurrence or claims made. But one important thing is, make sure that you understand all of those benefits and make sure that you understand what type of malpractice policy that the practice or the organization is offering for you. You want to make sure that you understand the malpractice, if it's occurrence or claims made. The difference between the two is occurrence is typically a little bit more expensive up front, but you don't need to tail out that policy. That policy, once you purchase it, it goes on for a very long time. It goes on forever. The claims made policies, those are a little different. And what I'm seeing right now are most policies on the market are claims made policies. But on those claims made policies, you want to make sure that you're discussing with the employer as to the tail coverage. Who's going to be responsible for that tail coverage? We were just recently working with one of our physicians who was coming aboard and coming from a different employer. Well, her agreement with the different employer prior to joining us, they hadn't negotiated that. And unfortunately, she was responsible to purchase that tail coverage when she left that practice. So that's another avenue that you really want to take a look at in your contract and make sure that you understand all of the components, because you don't want a surprise tail coverage bill whenever you're leaving that institution to go to another location.
Absolutely.
Now, for somebody who, again, hasn't really thought about malpractice before, I'd like to not think about it if I have a choice, but would it behoove me to get somebody who's more well-rehearsed in malpractice law to take a look at it, see if the contract is, most benefit for both parties, and just kind of go from there almost too?
Yes, I would recommend not necessarily an attorney versed in malpractice. A lot of times, you'll see attorneys versed in different areas, but absolutely, I would recommend for, once, whether you're a new physician coming out or you're a physician transitioning to another position with a new contract, always take your contract back to your attorney, have them review it, have them take a look at it. Maybe they see something in that agreement that you may want to have more information on, may want to have questions. So they review these contracts every single day. You want someone with that level of expertise reviewing your contract and making sure that you understand that these are the terms that both you're signing on behalf of and the practice that you're joining.
Awesome. Kind of tailing off what Tim said, as a new physician, you try not to think of malpractice or things down the road. You're just kind of so zoned in on becoming an attending that you kind of forget about things. What about retirement? You just got a new job and now they want to talk about retirement. What are the big keys that you want to look at for that within a health system or within a contract?
On the retirement component, where you review the benefits that that organization is providing for you, a lot of times you're going to see a retirement component in there, especially if that institution is competitive on their benefits. So you want to take a look down through there. What are they offering? Are they offering a match? Are they not offering a match? And I would really recommend to go down through their benefits and to quantify it as much as possible. Let's say it is a 2% match or maybe a 4% match. You can put that whenever you're doing your analysis on the contract, you want to assign a dollar amount to what those benefits are worth. So it gives you a good idea as to, if you have 3 offers coming out of residency or switching to another position, you want to make sure that you're comparing apples to apples with the compensation package, but also the benefits as well.
Absolutely. Other benefits in the contract for the physician, how important is it to look at kind of professional and personal expenses, meaning CME coverage, licensing and credentialing, relocation, reimbursement, that kind of stuff?
So those are all going to be included in your benefits package. In that benefits package, you're typically going to have your health insurance, if they're offering any eye or dental, but you're going to have a CME component and a PTO component. So on the benefit package, you want to take a look at the entire benefit package that the employer is offering. That's going to be all of your healthcare benefits. That's going to be if they're offering any CME. Is that a dollar amount on CME, or is that a dollar amount, like an expense reimbursement, or is that time? You want to take a look, is there professional dues membership included in that? All of these components you want to take a look at and compare that whenever you have offer A, B, and C on the table.
The one thing that I want to talk about for some contracts, because I know for even attendings that I've talked to when I've been on rotations, either as a med student or a resident, they always bring up a non-compete clause and they're like, oh, I have like this many mile radius that I can't practice within another hospital system that I signed with or whatever. I don't need to dive into specifics, of course, but can you shed some light on how non-compete clauses are kind of formulated? Do you look at hospitals in the general area and like make a consensus based on that?
So non-competes are essentially just what they say. There is a radius and a time frame that they are asking that physician, from the health system perspective, that they're asking the physician, we wouldn't want you to open a practice within this radius for this amount of time. And essentially, you want to make sure that you're comfortable with the language that you're going to be signing under that agreement. Maybe it's a 1 year, maybe it's a 2 year, and take a look at the radius as to make sure you're comfortable with the non-compete provisions in that agreement, because from the hospital standpoint or the practice standpoint, it's typically a lot of resources into recruiting a physician into that community. And they're going to put a lot of resources into building your practice, getting it up, getting it running, and hopefully attracting a lot of patients into that practice.
Sure, that makes sense. Now that we're getting into starting new practices after a contract, the thing that we don't want to talk about when a contract is terminated.
Right.
Or getting renewed in that process. So I guess when you have somebody who say they were a new attending that came in, they signed a contract, and now you're going to start to renew a contract. Based on what was in the last contract, are you making a lot of changes just based on things that they want? Is there a specific wage increase? Any kind of specifics you could shed light on for that?
Well, on the contract terms, on any type of renewal, I would have the same recommendations that I would on a new contract. You want to go down through that contract and make sure that you're comfortable with all of the terms in there, make sure the hospital's comfortable with all of those terms, and make sure both of you are agreeing on everything that's going in there. But to jump back to your first point that you had started talking about was the termination component. In a typical agreement, there's two different termination components. There's a for-cause termination and there's a not-for-cause termination. Now, the for-cause would be whether the hospital or the group that's employing you or the physician themselves, if someone was violating the terms of the agreement. For example, in some agreements, you are going to have the privileges. Like, for example, if your privileges at that hospital are revoked, there may be clause language in there that would be a for-cause termination within that agreement. The other type of termination notice would be a non-for-cause. And on that non-for-cause, it typically has a time frame to it. Sometimes 60, sometimes 90, 120, somewhere in that. I've seen contracts all in those ranges, but that is a opportunity for yourself or the hospital to terminate that agreement without cause. So not saying anyone violated any components in that agreement, but for non-cause reasons, for anything, you could go ahead. Like, for example, if you had found a different position or you decided that it was too cold outside, you wanted to go somewhere warm, you would go ahead and end that contract. You would give that organization the notice in the contract. Like I said, sometimes it's 60, 90, 120 days. You give them notice. And then at the end of that notification period, that's when that contract would terminate.
So my next biggest question for you, Megan, parts of the contract, what parts are typically negotiable versus things that are really non-negotiable and you're really not going to get a lot of give and take on?
Each hospital and each organization or practice is going to be different. You're going to have different components that they are solely interested in this piece that they have to have. What I would recommend is working through that agreement, work through it with the health system, and let them know truly what's important to you. Before walking into any discussions with that health system, you want to sit down and say, okay, well, A, B, and C are most important to me. And you want to work with them to have those worked into that agreement. Like I said before, maybe it's lifestyle, quality of life. Maybe it is compensation. Maybe it's a third component, or scheduling. We see a lot of physicians now that scheduling is very important to them. So just make sure that going into that conversation what's important to you. Make sure the health system that you're working with, take a look, talk to them, share with them what's important to you, and they will try to work those components into the agreement.
Perfect.
And just because of where we are currently, because we're currently in DuBois, Pennsylvania, so we're more familiar with a rural hospital system and rural contracts and that kind of stuff. Are there any specific differences that you know of in terms of a rural contract? Because we're going to be reaching all across Pennsylvania, right? So there's going to be some physicians in Philly and Pittsburgh that are trying to get contracts in more of an urban environment. Are there any differences that you can comment on between a rural kind of contract or an urban kind of contract?
Well, a lot of your contracts from that nature, they're going to vary, not necessarily rural versus urban. They're going to vary health system to health system. Each health system works with different attorneys that draft, when you get this contract in hand, coming as a, maybe a third-year resident, you get a contract in hand, it is full of legal language. They've had attorneys draft up these agreements, and that's all health systems across Pennsylvania. Attorneys draft these agreements. So you definitely want to go down through, take a look at that. You see a lot of differences, compensation structure, to answer your question, Tim, from an urban versus a rural. But truly from the contract standpoint, it's all going to depend upon the attorney that the health system's working with to draft that agreement.
Okay. Perfect. Megan, I know we had briefly touched upon the renewal of contracts. Is there like an average timeline of how often contracts are looked at and renewed for physicians, or is that also healthcare based, like health system based?
Yes, that is always healthcare based. Each organization is going to be a little bit different as to what their needs are and how often that they renegotiate their contracts. I thought of one more thing that I just wanted to highlight. On the terms of the agreement itself, you're going to take a look. There's a bunch of different compensation packages and structures that you could be offered. But take a look. There's other components to that agreement that is going to have forgiveness terms to that. Make sure that you're reviewing that component of your agreement as well. Some organizations do that with their relocation assistance. You have to stay X many years, whether it's 2 years, 3 years, 4 years, or you owe a prorated portion of that back. Or perhaps it's maybe a sign-on bonus or something else. Just make sure that you're truly, going through that contract with your attorney and making sure that you understand any components and all components in that agreement. Because again, like I had mentioned on the physician with that tail insurance, you want to make sure that you don't have any surprises, if in the event that you decide to go to another organization with a different contract.
Absolutely. I think the biggest thing I got out of our discussion today is really to make sure that you go through your contract with a fine-tooth comb, make sure you're okay with everything. And if you don't understand something, ask, get an attorney to look at it. Just make sure that it's what you need it to be and what the employer needs it to be before you kind of come to the agreement before you start your job. So
absolutely.
Yeah, a lot of these questions that we answered, you talked about the subjectivity of it all.
Mm-hmm.
Each one is kind of like its own little snowflake. Every contract is unique to everybody because everybody has a unique situation.
Mm-hmm.
Right.
And I feel like if you don't do that, if you don't go through that process, go line by line with your contract, you're going to end up probably not being as happy with the contract that you sign.
Right.
Absolutely. So I want to take this time to thank both of you for participating in today's discussion about physician contracts. I think this is such an important topic for both new physicians coming out of residency or fellowship, and we talked about renewals as well. Anyone that maybe hasn't done that for a few years, that can listen to this and kind of get caught up on the highlights of things they need to pay attention to. If any of our listeners have any feedback or ideas for future episodes, please email POMA@POMA.org and be sure to subscribe to our POMA Does podcast on your favorite podcast platform and POMA's YouTube channel. We'll see you next time.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube, or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.